Hey coders, welcome to Medical Coding Scenarios, brought to you by CEU Hub, where coders connect. Quick disclaimer, CEU Hub provides educational content for informational purposes only. This content does not constitute professional coding advice. Always verify codes using current official coding manuals, guidelines, and payer-specific requirements. Coding Scenario Sundays, Episode 3, Part 1. Inpatient Nephrology Consultation. Today's scenario. Our patient name is Margaret Wilson. She's 68 years old. She was admitted with acute decompensated heart failure. Dr. Shin requested a nephrology consultation for elevated kidney labs. Patient history. The patient has a history of CKD stage 5 for 2 years, baseline creatinine level at 3.2, type 2 diabetes, hypertension, and congestive heart failure. Dr. Thomas, the nephrologist, had to order some labs for the patient, and he ordered CMP, CBC, urinalysis, and PTH. He also ordered a CT scan and reviews the imaging independently. He discussed the case with Dr. Sheen. His assessment was that the patient had newly diagnosed end-stage renal disease with a Monday, Wednesday, Friday hemodialysis to be initiated, hypertension, chronic systolic diastolic congestive heart failure, and type 2 diabetes. Now let's code this together. The nephrologist listed end-stage renal disease first in the assessment. That's their specialty and that's what they're treating. So I'm going to start with that diagnosis and then I'm going to flow into the others. So I'm going to open up my ICD-10 to disease. And I'm going to go from disease to renal. From renal, I'm going to go down to end stage. So that end stage gives me the code N18.6. I'm going to take that code to my tabular. And I'm going to start over here with the parent code. The parent code is N18, and that says chronic kidney disease. Now, before I go to our specific code, I'm going to start off here with the parent code, and that's N18, and it says chronic kidney disease. So I'm going to pay close attention to any notes up under here because especially knowing that we have multiple diagnoses. So I'm going to make sure that I'm coding correctly. So I'm going to look at the official guidelines and then I'm going to go into the other instructions. First, it says see official guidelines, hypertensive chronic kidney disease. It says IC9A2 for hypertensive heart and chronic kidney disease. And I think that's what we're going to be looking for, right? Because we know that this patient has she's hypertensive and she has heart disease as well as kidney disease. So I'm going to take that to the front of the book where the guidelines are. And I'm going to look in the table of contents. So now that we're in the front of the book where the official guidelines are, I'm going to look for our guidelines that the parent code pointed us to, and that is IC9A2. So the first thing I'm going to look at is the section number, which is I. The next thing I'm looking for is C, so A, and then it goes all the way to the C. From C, it says 9. So I'm going to go along here until I find 9. And from chapter 9, I'm going to go A. And then A, it says G16. And I'm going to go to Now that I'm on G16, we're going to completely look at where we left off from the contents page. And it says chapter 9. And then from chapter 9, it says we have to go A. And from A, we're going to look at 2. So we went I, section I, then C. From C, we went to chapter 9. Chapter 9, we went A. And from A, we landed here at 2. In 2 states, hypertensive chronic kidney disease. Assign codes from category I-12, hypertensive chronic kidney disease, when both hypertension and a condition classifiable to category N18, chronic kidney disease, CKD, are present. CKD should not be coded as hypertensive if the provider indicates that the CKD is not related to the hypertension. Also, if we keep going and we look at 3 states hypertensive heart and chronic kidney disease. And this states the codes in category I-13, hypertensive heart and chronic kidney disease, are combination codes that include hypertension, heart disease, and chronic kidney disease. Assign codes from combination category I-13, hypertensive heart and chronic kidney disease, when there is hypertension with both heart and chronic kidney disease. If heart failure is present, assign an additional code from category I-50 to identify the type of heart failure. So now we have this one code for the combination of hypertension, heart disease, and chronic kidney disease. And also in the guidelines, they have a flow chart to help us choose the correct diagnosis as well. So we're going to start off here with the hypertension, and it says with heart disease or CKD. Our patient has CKD, so we're going to go here first, and it says CKD, and it's yes, and then is it associated with heart disease? Yes, and then it's asking type of heart disease, failure, or CKD, and we know that our patient has end-stage renal disease. So our patient has heart failure and CKD stage 5 or end stage. So then it goes and it point down to these 3 codes. The I-13.2, number 2, the type of heart failure, which is the I-50. So now we have to look for our I-50 code, and then a 3 stage of the CKD, which is the N18.6. So now with this newfound information, we're going to go back to the tabular, right? So now we know that we have our I-13 for the hypertensive heart. We also have to code the stage of renal disease, and now the type of heart failure. So going back to the tabular list to finish reading our instructions for our end stage code, we're going to find our parent code again. So we read our official guidelines. So now we know exactly how to choose the correct code. But it also say in red, code first, any associated diabetic chronic kidney disease. And it goes on to list all of the diabetic chronic kidney disease codes. So we have E08, E09, E10, E11, E13. But then it also says hypertensive chronic kidney disease, I-12 or I-13. Now from here, we know that we're coding the I-13 because that gives us the hypertensive heart with the CKD. So we're going to do the I-13, and we also have our kidney code, which is the end stage, the N18 end stage renal disease. Okay, so now based off our guidelines, we know that we have to code the heart failure. So let's just take it back to the tabular. We're going to take it back to the tabular, and we're going to look for failure. We're going to go failure, From failure, we're going to go over to heart. From heart, we're going to go with, and then we're going to go down and find our combined code of the diastolic and systolic. So then it says here, diastolic. From diastolic, we're going to go combine with systolic congestive. And then it gives us the I50.40, but it's chronic. So from here, it says acute. That's not what we need. And then we're going to go chronic, and it's I50.42. So we're going to take this heart failure code of I50.42, and we're going to take it to the tabular. First, let's look at our parent code of I50. Of course, it says to see official guidelines. We kind of already looked over our guidelines. That's how we got the answers to come here. And it also gives us the note about the heart failure due to hypertension with chronic kidney disease, I13. We know we're going to need our I13 code, which was I13.2. When we looked it up in the flow chart, we're going to go and look at that as well. But first, let's focus on our heart failure code. So then we're going to go to our specific code. And when we go to our I50.42, it says chronic, combined, systolic, congestive, and diastolic congestive heart failure. So now, so far, we have our end-stage renal disease code, which is the N18.6. We also found our hypertensive code, which is the I13.2. We found that in the flow chart, which is, we're going to look that up next. And now we have found our heart failure code, which is the chronic combined systolic, congestive, and diastolic congestive heart failure. So now let's go and look into our hypertensive code, which is the flow chart gave us the I13.2. So we're going to start off with our parent code, I13, that says hypertensive heart and chronic kidney disease. We kind of already looked at our official guidelines. And then we're going to go off and look for the I13.2 that the flow chart gave us, which is here. And it says I13.2, hypertensive heart and chronic kidney disease with heart failure and with stage 5 chronic kidney disease or end-stage renal disease. And it also says to use additional code to identify the heart failure, which we did, which is the I50.42, and use additional code to identify the stage of chronic kidney disease, which is the N18.6 for end stage. So now we have our clear hypertension or hypertensive heart code, which is the I13.2. We also found our heart failure code, which is the I50.42. And we have our end stage renal disease code, which is the N18.6. We're going to go back to our end stage code just to read additional instructions because I know I saw one instruction about the diabetes. So we're going to take that back to N18 and we're going to finish looking at our instructions. So we coded, we saw our guidelines, we referenced our guidelines, we referenced our flow chart. We found our hypertensive chronic kidney disease code, which is the I13.2. We also found our heart failure code, which is the I50.42. So now it says code first. So we already know these are going to be coded first. But an additional code, an additional diagnosis that our patient had was diabetes. And here it says code first any associated diabetic chronic kidney disease. And it goes off to list all of the other, the diabetes codes. So we're going to start from the index and then we're going to work our way back. Even though they listed it here, we're going to look for it in the index and we're going to take it from the index to the tablet. So we're back in the index and we're looking for our diabetes code. So of course we're going to go up under diabetes. From diabetes, we're going to go with chronic kidney disease, and that gives us the E11.22. We're going to take that E11.22 to the tablet. We're going to start with the parent code first to read any instructions that we may need. Here it says to see official guidelines. It says diabetes in pregnancy, which is not our patient. She is not pregnant. So it has includes, which is diabetes NOS. And then now we're going to go down and look for our specific code that we found in the index, which is the E11.22. We're going to start here at the 11.2. We know we need a fifth character, which is we already know it's a 2. But this says type 2 diabetes with kidney complications. And then if we go down to our more specific code, which is the E11.22, it says type 2 diabetes with diabetic chronic kidney disease. Use additional code to identify stage of chronic kidney disease, N18.1 through N18.6. And we already have our chronic kidney disease code, which is the N18.6. So now that we have all of our codes, we have our end stage code, our hypertensive code, we have our heart failure code, and now we have the diabetes code. Even though we thought we were done there, we're not, because looking at our instructions, if we go back to the N18 code, which is the N18.6, it also says, and it tells us to use additional code to identify dialysis status. And that's a Z code, right? So now that this patient has end stage, they're relying on or they're dependent on dialysis for a treatment. Now we're going to go and look for our Z99.2. But before we look at that, I want to stop and look at the beginning of the chapter and look at this chapter specific code guidelines. And here specifically, it says the use of Z codes in any healthcare setting. So it says Z codes are for use in any healthcare setting. Z codes may be used as either a first listed principal diagnosis code in the inpatient setting or secondary code depending on the circumstances of the encounter. So then when we're looking at that, we want to make sure that our code doesn't fall up under primary, which is I already know that our code doesn't, but it is helpful to look at chapter guidelines as well. So if we look at ours, and it also has guidelines for principal diagnosis codes. And if we look here under 15, these Z codes, it says that may only be principal or first listed diagnosis. And it goes on to list the different Z codes that in certain circumstances could be may only be listed as principal or first diagnosis. So then we continue over and then we see the rest of the codes here. And none of these are the Z99.2. So we already know that our code is not going to be sequenced as a primary Z code or a first listed. It's going to be listed as a secondary, but it's also going to go in the sequence of the other codes, which is what we found on the flowchart. So now let's go to our Z99.2 code. Now we found our Z99.2, and it says dependence on renal dialysis. So this is our Z code for the dialysis treatment. And it just states hemodialysis, peritoneal dialysis status, and other exclude ones and exclude two notes. So now we are officially done with all our codes. We have our correct sequencing, and this Z code is going to go at the very bottom of all our other codes. Let's trade our ICD-10 book for our CPT. So now we're going to look for our consultation code. Now that we have our CPT book, we're going to go into coding our inpatient consultation code. Now we're going to code based off of MDM this time. So medical decision making, because it's no time listed on the documentation. So with that being said, let's open up our index. We're going to start at the index and let's find our evaluation and management code. Okay. All right, so here we are. We are under evaluation and management. And from there, we're going to go hospital services. So we're going to go down to hospital services because this patient is in the hospital. And then from hospital services, inpatient or observational care. And from inpatient to observational care, we're going to go down to consultation. When we go over from consultation, it gives us the code 99252 through 99255. But before we go to the tabular, since we're coding by medical decision making, we're going to go take a visit to the beginning of the book and we're going to start off looking at the table. Let's look at moderate. And then for moderate, we're going to look at the numbers or problems addressed. It says all we need to satisfy the moderate for problems addressed is one or more chronic illnesses with exacerbation, progression, or side effects of treatment, two or more stable chronic illnesses, one undiagnosed new problem with uncertain prognosis, one acute illness with systemic symptoms, or one acute complicated injury. So with that said, we already have, with our diagnosis and problems that our doctor addressed, we already have moderate. So let's take it one step forward and let's go to high, because at this point, we might even can go off into high with the diagnosis that we have. So for high, it says one or more chronic illnesses with severe exacerbation, progression, or side effects of treatment. We definitely hit this one with our ESRD. And it says, or one acute or chronic illness or injury that poses a threat to life or bodily function. And that's definitely the newfound end stage renal disease, right? Because that is a high risk diagnosis. Because first, it's it it's a threat to life, right? It's the end stage is requiring urgent dialysis, and he has acute compensation. He has the decompensation, chronic kidney heart failure. I'm sorry, chronic heart failure, as well as other things going on. So for our first level, our first element, we're going to select high for problems addressed. Now that we have one of our elements satisfied, we only need one more element to code our level high. So we're going to go over here to amount of the data to be reviewed and analyzed. We must meet at least 2 out of 3 categories. So we either need category 1 and 2, category 2 and 3, 1 or 3, either whichever combination you have, we at least need 2 of them. And so we can go right to category 3 for the discussion of management or test interpretation. So that category 3, we had a discussion with Dr. Shan. So that satisfied category 3. But can we satisfy another category to say, hey, this gives us a high and this gives us our 2 elements, and now we have our high. So our second category, independent interpretation of tests. Independent interpretation of tests performed by another physician, other qualified healthcare professional, not separately reported. This one is actually satisfied. So with the number of problems addressed, or the numbers of complexity of problems addressed, and the complexity of data reviewed and analyzed, this gives us 2 of the 3 elements that we need to code the high. So now we know that we're coding our medical decision making at a high based off of the documentation. And we're going to take that to the tabular list because we already looked up our codes in the index. So we're going to look up the inpatient consultation codes. Okay, so now we're going to look up under the inpatient or observation consultation, new or an established patient. And we're going to start over here because we already know we have our complexity level based off of our medical decision making table. But we're going to start here. It says the 99252 and it goes down to 99255. The 99255 is inpatient or observational consultation for a new or established patient, which requires a medically appropriate history and or examination and high level of medical decision making. But even with looking at this 99255, we have a slight dilemma with this code. Traditionally, 99255 would be the inpatient consultation, but CMS eliminated consultation code use back in 2010 and most payers follow CMS guidelines. So our option would have been the 99255, but you only can use that if payers accept that consultation code. So you definitely want to check with the payers guideline or payer policies when it comes to that code. So we're going to go with CMS standards. But for our code, we're going to use the 99223, and that's for the initial hospital inpatient or observational care. So initial meaning the first visit, and that code gives us our high level of medical decision making. So that is our final CPT code. So let's do a quick recap. So for our diagnosis code, our ICD-10, for our first code, we have the I13.2, and that's our hypertensive heart code. Our second code, which is I50.42, which is our chronic combined systolic diastolic CHF. Our third code is the E11.22, which is the type 2 diabetes with CKD. And our fourth code, the N18.6, and that's our end-stage renal disease code. And our very last code, which is our Z99.2, is our dependence on renal dialysis. That is it for episode 3 of Coding Scenario Sundays. Don't forget to like, share, and subscribe. Thanks for tuning in, and I'll see you next Saturday with another coding scenario. Until then, keep coding.